Hello, my name is Isabella, and I am the family nurse practitioner student that will be taking care of you today. Before we begin, I'm going to clean my hands with hand sanitizer, and I would apply the appropriate protective equipment for your safety as well as mine. Could you just please tell me your name and date of birth?
Jacob Lincourt, 22001.
Perfect, thank you. Today I'll be performing a full head-to-toe assessment. This will help me assess how your overall health is and identify any early signs of potential problems. I'll explain every step as I go, and nothing should be uncomfortable or painful. And if you are uncomfortable or something is painful, please let me know at any time. Do I have your consent to proceed?
Yes.
Okay, great. First, I'll make sure that you're comfortable and have privacy. I would also ensure proper lighting, and I would drape you with a gown, or if need be, I'll position you sitting, standing, and lying down as needed. I've gathered all of my necessary tools like my stethoscope, thermometer, pulse oximeter, blood pressure cuff, reflex hammer, otoscope, tongue depressors, ophthalmoscope, Snellen chart, and tuning fork. We also have good lighting and a quiet room for accuracy. So first I'll start with your vital signs. So I'm going to put this on your finger, and I'm going to take your temperature underneath your tongue. Keep that underneath your tongue. You can hold it with your hand until it beeps, and an increased temperature might mean an infection or inflammation. I'll also do your blood pressure while that is loading. So I will do it in both arms. So I'll start with the right arm. Normal is 120/80. A high blood pressure could mean hypertension, and a low blood pressure could indicate dehydration. One 18/78. And the left arm, you could switch arms. One 12/75. I will also take your pulse, and with pulses I'm noting rate, strength, and rhythm, which normal is 60 to 100 beats per minute. And for this exam, we'll count for 15 seconds and multiply by 4, but with a normal exam, I will count for a full minute. And heart rate is 64 beats per minute with a regular strength, rhythm, and they're 2+. During this exam, I've also, your oral temperature is 98.7, which is within normal limits, and pulse ox is 98. During this exam, I've also been noting your respiratory rate. So it has been 14 breaths per minute. Normal is between 12 and 20. Your respirations look unlabored, and chest rise looks symmetrical from what I can tell. The last vital sign I will test is any pain. Do you have any pain?
Do not.
Perfect. If he did, I would note the onset, location, duration, characteristics, aggravating factors, relieving factors, and if any treatments were performed at home. So now I will observe your general appearance. This helps me understand your general health, demeanor, and hygiene. You do not seem to be in any acute distress, and your general health and hygiene look adequate, and demeanor is calm and relaxed. I'm also checking your nutritional status, or I'm looking for signs of malnutrition, obesity, or muscle wasting, and your nutritional status seems adequate with no signs of malnutrition, obesity, or muscle wasting. I'm also looking at your body habitus for unusual proportions, excessive thinness, or weight gain, and none of those are noted. Your body build is appropriate for you. And now if you could just please stand up and walk a small distance. As you walk, I'm watching your posture and your gait and balance for limping or unbalanced, which your posture is erect and neutral, gait is smooth and coordinated with no abnormal movements within your walking pattern. And I'm also listening to your speech for clarity and fluency and appropriateness. It should be clear and fluent, and you can have a seat now. I'm making sure that there's no slurring, aphasia, which none are noted. And I'm also noting your behavior and looking for any signs of agitation, distress, or inappropriate behavior, which your behavior is calm and appropriate with no signs of agitation, distress, or inappropriateness. And now we'll move on to the head and neck. So I will start with your head, and I'm inspecting your head for any lesions, deformities, wounds, swelling, scalp lesions, or bumps. Now I'll gently feel your skull for any bumps, lumps, lesions, or masses, which none are noted. And now I'm checking that both sides of your face are symmetrical and that there are no signs of tremors or twitching. Any twitching or drooping could indicate nerve issues, and the head and the face are symmetrical with no abnormalities noted. And moving on to the eyes, then I'll look at the white parts of your eyes, which are the sclera. I'll look inside your eyelids, which are the conjunctiva, upper and lower, and I'll also look at your corneas. Scleras are white, conjunctivas are pink, or conjunctivae are pink, and corneas are clear and transparent bilaterally. I'll check your vision with this Snellen chart. So please cover one eye and read the lowest line you can read.
LTFPH.
Perfect. And cover your eye and read the lowest line you can read.
LTFPH.
Vision is 20/20 bilaterally, and now I will perform a fundoscopic exam using this ophthalmoscope to look at your retina, optic discs, and blood vessels in both eyes. And optic discs are sharp, and the retina and blood vessels are normal. And now I'll shine this light into your eyes to check your pupillary response. Both pupils should constrict equally to light with direct and consensual response as well as accommodation. So if you could focus on this object and then towards your nose. Pupils are equal, round, and reactive to light and accommodation. And now I'll check your eye movements. If you can just follow my finger in the 6 cardinal directions. There shouldn't be any jerky eye movements or nystagmus. Which none are noted. And now I will inspect the outer parts of your ears. I'm looking for any deformities or lesions, which none are noted on both ears. And now I'll use this otoscope to look in your eardrum, which should be pearly gray. And cerumen in that ear. And there is cerumen in that ear. But eardrums are pearly gray and reflect to light. Now I will assess your hearing, so I will perform the whisper test. I'm going to stand on the side of you and say whisper words. If you could just repeat them.
Dog. Ocean.
Okay, perfect. Now we'll perform the Ryan and Weber tests, which test for conductive or sensory neural hearing loss with this tuning fork. So please tell me if the sound is louder in the right ear, left ear, or they're equal in both ears.
Equal in both.
Perfect. Now for the Ryan test, I'm going to place the tuning fork on the bone behind your ear and then next to your ear when you can't hear it anymore to test bone conduction versus air conduction. So if you could just please cover one ear and let me know when you no longer hear the sound. And when you no longer hear the sound, when the tuning fork is behind your ear, I will move it next to your ear. And then if you could just tell me when you can't hear it again.
Can't hear it. Can't hear it.
No conductive or sensory neural hearing loss noted. And next I will move on to your nose. So for your nose, I'm going to look inside your nostrils for any abnormalities. It can also use the otoscope to look for any swelling, discharge, or a deviated septum, which the nose is midline with pink nasal mucosa and intact turbinates. No septal deviation, swelling, or discharge is noted. So now I can move on to the mouth and throat. So if you could just open your mouth for me, please. Perfect. I'm checking the lips, gums, teeth, oral mucosa, tongue, and cheeks for any lesions, sores, signs of oral cancer, or other abnormalities. I'm also looking at your tonsils, which there are no tonsils. And I'm checking your uvula for symmetry and swelling. If you could just say ah, making sure that the palate rises equally. And then if you can just swallow for me. Perfect. Just want to make sure that you're able to swallow. Was there any difficulties?
There was not, no.
Perfect. Now I'm looking at your lips. And lips, gums, teeth, oral mucosa, tongue, and uvula. Do not have any swelling or asymmetry. No lesions or signs of oral cancer noted or sores. No vesiculations, abnormal movements, anything like that. Your tongue movements are intentional and smooth, and then no dysphagia was noted. And now we can move on to the neck. So I'm looking for symmetry and any skin abnormalities. Neck is symmetrical with no abnormal masses, lumps, bumps, lesions, or skin issues. I'm also going to palpate your lymph nodes. I can also palpate your neck for any lumps or bumps. But then your lymph nodes shouldn't be enlarged or tender, so your preauricular lymph nodes, your parotid, tonsillar, postauricular, occipital, submental, submandibular, anterior cervical, and posterior cervical lymph nodes. And no swelling or tenderness noted on exam, and they are within normal limits. And now I will palpate your thyroid, so I will move behind you to check for the size and any nodules. If you can just swallow. Perfect. An enlarged thyroid could indicate hyperthyroidism or hypothyroidism. And your thyroid is soft, smooth, with no palpable nodules or masses. So now we can move on to the cardiovascular exam. So if you could just lay flat like that and lift your shirt, please. I will start with inspection. And I'm looking at your chest for any visible pulsations or abnormal precordial movements. To assess for JVD, I would have you sit at a 45-degree angle and ask you to turn your head to one side. And I would look for any visible bulging or pulsations. On the neck, which no visible pulsations or abnormal precordial movements noted, no JVD, and chest looks symmetrical with no surgical scars. So next, I'll feel your chest for the apical impulse, which should be at the 5th intercostal space midclavicular line. And I can feel it. And apical impulse is in the right position, 2+ with regular rate, rhythm, and strength. No thrills or abnormal pulsations noted. And next, I will auscultate. So I'll listen to your heart with the diaphragm and then the bell of my stethoscope at the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. For normal S1 and S2, I'm listening for murmurs, which could mean valve problems. I'm listening for gallops or rubs. And I'm also assessing your heart rate and rhythm during this time, which I also assessed with your pulse. So if you can just sit up for me. I'm going to listen to the aortic at the 2nd intercostal space, right sternal border, and with my bell. And now pulmonic, 2nd intercostal space, left sternal border, and Erb's point, 3rd intercostal space, left sternal border. This is best heard in the left recumbent position. And then tricuspid would be the 4th intercostal space, left sternal border. And then the mitral would be the 5th intercostal space, midclavicular line. Heart rate and rhythm are regular and within normal limits. S1 and S2 are present with no abnormal or extra heart sounds noted in all 5 areas. And so now I can check all of your peripheral pulses. So I will start with radial. And then we can do femoral. We can do patellar. And posterior tibial. And the dorsalis pedis. We can also check the renal and inguinal arteries as well, which all pluses are regular. 2+ with regular rate and rhythm. And now I can check your capillary refill, which should be less than 2 in your fingers and toes, which we cannot assess your toes because you have socks on. But capillary refill in fingers are less than 2 seconds. And now I'm going to press on your legs for any swelling, which would indicate edema, as well as look at your legs for any dependent edema. And now we can move on to the respiratory system, so you can sit up, please. So I'm inspecting the chest or the lung fields for symmetry, shape, and signs of abnormal breathing. It should be symmetrical with no use of any neck muscles or barrel chest or cyanosis, which is a blue tint. And respirations are unlabored, and I can also lift your shirt to make sure that chest rise is equal with no accessory muscles, no increased work of breathing noted, or barrel chest, cyanosis, use of accessory muscles, or respiratory distress. I'm also looking at your fingers and your toes for any clubbing, and again, cyanosis, which is a blue tint. And then moving on to palpation, I'll feel your chest for any tenderness, which is any noted, or any abnormalities in the chest wall. No tenderness or abnormalities noted on exam. I will also check that it expands symmetrically, so I can do that by placing my hands on your chest and asking you to take a deep breath. Perfect, in the front and in the back. Perfect. Now on a normal exam, we can start with normal breathing and then go to deep breathing, but it seems as though your breathing is symmetrical. And now I can tap on your chest and your back to make sure that it sounds hollow, or what we know as a resonant sound. So I would tap in all lung fields. And resonance heard in all lung fields anteriorly, and in another exam I would do it posteriorly. And now I'm listening for your bronchiovesicular and vesicular lung sounds. Bronchial sounds are higher pitched and heard over the trachea and large airways. And bronchiovesicular sounds are a mix of the two with a medium pitched intensity and are typically heard over major bronchi. And then lastly, vesicular sounds are soft, low pitched, and heard over most of the lung surface. Your breath sound should be clear with no wheezing, crackles, or rhonchi, which could mean asthma, infection, or some sort of fluid buildup, which breath sounds are clear with no adventitious lung sounds noted. So now I will perform a few tests. First is bronchophony. So I would like you to say 99 repeatedly in a normal voice, and I will use my stethoscope to listen to the diaphragm over multiple areas of your chest, comparing both sides
99.
bilaterally,
99. 99.
anteriorly and posteriorly.
99.
The word 99
99.
should sound muffled and indistinct.
99.
If it was louder and clearer than normal, this could indicate lung consolidation. And so next is egophony. So I would like you to say the letter E
E.
continuously.
E.
And I will listen with my stethoscope, and the sound should be soft, a soft and muffled E.
E.
If the E sounds like an A, this could indicate denser lung tissue, which is common in pneumonia. Lastly, I will perform whispered pectoraloquy, which is, I would like you to whisper 1, 2, 3 several times, and I will listen again with my stethoscope. And the whispered words should be faint or inaudible over normal lung tissue. If the words are clear and distinct, this could suggest lung consolidation. And bronchophony, egophony, and whispered pectoraloquy is negative on exam. So now we can do an abdominal assessment. So I'm going to ask you to lay flat with your head also on the white part and with your knees slightly bent to the ceiling. And I'm looking for, I'm going to just raise your shirt. Now I'm looking for any distension, pulsation, scars, or visible masses. I may see movement from the aorta or digestion, aorta in a very thin person, or digestion known as peristalsis. Abdomen is flat and symmetrical with no distension or scars, visible pulsations, masses, or anything like that noted. And now I will listen in all 4 quadrants for bowel sounds. They should be present every few seconds, starting in the right lower quadrant. Hypoactive bowel sounds may indicate a blockage, where hyperactive bowel sounds may suggest something like gastroenteritis. And bowel sounds are normal active in all 4 quadrants. I can also listen over the abdominal aorta and the renal and femoral arteries for any bruits. Abnormal sounds could mean narrowing of the arteries. So aorta, renal, and renal. And now I'll move on. No bruits are noted. And now I'll move on to light palpation, starting in the right lower quadrant, moving through all 4 quadrants of the abdomen. And now I'm going to press a little bit deeper to assess for any masses, tenderness, enlargement of any organs. Is any tenderness noted?
Nope.
Perfect. So I'll also feel for the liver in the right upper quadrant. Which liver is palpable. I would also palpate for the spleen in the left axillary line. And the liver should be palpable, and the spleen and the kidneys should not. So I'm also palpating your kidneys. And no tenderness, guarding, or masses noted on light or deep palpation. And liver was palpated in the right upper quadrant, and the spleen was not palpable, and the kidneys were not palpable as well. So now we can percuss your abdomen. I'll start in the right lower quadrant again. Normal is a hollow sound known as tympanic. Tympanic heard in all 4 quadrants of the abdomen on percussion. I'll also percuss the liver and spleen borders for size. So starting with the liver border, I will start above the lungs and I'll hear resonance, and I'll go until I hear dullness. And then note that spot, and then I will start at the abdomen where it's tympanic until I hear dullness. And a normal liver span is between 6 and 12 centimeters. And now I'm going to percuss the left axillary line. This is where the spleen is. And if you can just take a deep breath, inhale. Perfect. Splenic border was not percussible. And now we can move on to the musculoskeletal system, so you can sit up, please. I will assess your posture and your gait, which I assess during the general inspection, and I will make sure that your joints look symmetrical. And while you were walking in here, gait was smooth and coordinated with no abnormal movements, and posture is neutral and erect, and joints look symmetrical. So now I'll move on to palpation. I'll palpate your bones, your joints, for any pain, tenderness, swelling, or deformities, which no tenderness, pain, swelling, or deformities noted. And now we can do range of motion. So we're going to test your range of motion. You should be able to move freely without pain. Please let me know if there are any pain or trouble moving. So we'll start with active range of motion. So we can start with your neck. So if you could just flex your neck, bring it down, chin to your chest, and then extension like you're looking at the ceiling. Perfect. And then we'll move on to lateral bending. So you can tilt your head, your ear towards your shoulder, and the other side. And now we can move on to rotation. So look to your right and look to your left. Perfect. And then we can do now we can move on to your shoulders. So we'll move your shoulders through a few movements. We can do flexion, so please raise both arms straight out in front of you and above your head. And now we can move to extension, so bring them straight behind you. Perfect. And then we will do abduction, so that's lifting your arms to the sides like you're doing a jumping jack all the way up. And then adduction, if you can bring them across your body like you're giving yourself a hug. Perfect. Okay, next we can move on to internal rotation. So this would be placing your hand behind your back like you're trying to scratch your back. Like your mid back. And then external rotation would be if you put your hands behind your head like you're relaxing the chair. Okay, perfect. And with the shoulders, limited range of motion or pain could suggest a rotator cuff injury or shoulder dislocation or a joint issue. And so next we can move on to the elbows. So for this range of motion, we can do flexion like you're doing a bicep curl, or extension, which is straight out in front of you. And then I believe that's it for the shoulders. And then for the wrists, we can do supination. So put your palms up like you're holding a bowl of soup. And pronation, so palms down to the floor. And then you can also flex your wrists down to the floor like an upside down prayer. And up like you're telling somebody to stop. So with the elbow, if there's any pain or limited range of motion or arthritis, that can indicate arthritis or something like tennis elbow. And for the wrist, we can do radial deviation. So if you bring your fingers towards your wrists, and then ulnar deviation would be outwards. Perfect. So now we can move on to the hips. So if you can flex your knee up to your torso like this. Perfect. And if you can bring it out behind you like this. Perfect. And then you can also bring the hips out like you're doing a starfish. This is abduction. And then for adduction, you would bring your legs in towards each other. And both legs. And then for the spine, we can do, for flexion, if we could just touch our toes. Perfect. And then extension would be leaning backwards. And lateral bending would be sliding your hand down one side and the other side. And rotation would be twisting side to side. With the spine, any pain or limited range of motion could be because of a muscle strain, herniated disc, or osteoarthritis. And we already checked the movement in your hips, so now we can move on to your knees. So flexion of the knee would be bringing it back like you're kicking your butt. And extension would be extending it straight forward out in front of you. Sometimes there can be hyperextension of the knee. That could mean a weak quadriceps muscle. And then you could do it on the other side. Perfect. And extension. Perfect. Then we can move on to your ankles. So we can dorsiflex the foot, which is flexing it upwards. And you can point your toes towards the ground. That would be plantar flexion. And then you can turn your foot inward. This would be internal rotation. And you can turn your foot outward. That would be lateral rotation. We can also do the fingers. So we can move our fingers and our toes as well. Perfect. Active range of motion is expected in all areas. There was no limitations, crepitus, or pain noted in the shoulders, elbows, wrists, hips, knees, or ankles, fingers, and toes. Passive range of motion, so similar to active range of motion, we can perform passive range of motion in all the same joints if you couldn't move on your own. So for example, with the elbow, I could flex his elbow and extend his elbow for him to assess passive range of motion. So active range of motion and passive range of motion is intact in all areas. So now I will test your muscle strength in the upper and lower extremities on a scale of 0 to 5. Normal is full strength against resistance. I'll check your strength in your neck, shoulders, elbows, wrists, hips, knees, and ankles. So first we'll start with your shoulders, and then we can do elbow extension, so bicep curl, and down towards me, and like you're doing a jumping jack, and down. And then we can do your hips, so move your knee up and move it back and to your knees. So sit down, please. Push your leg against my resistance and against my resistance, and push your feet like you're pressing the gas pedal, and up. And perfect. Strength is rated a 5 in all areas. So now we can move on to your reflexes. So I will grab my reflex hammer and I will test your biceps, triceps, brachioradialis, patellar, and Achilles reflexes. So biceps and triceps and brachioradialis and patellar and Achilles. And all reflexes 2+. If hyperreflexia was noted, I would test for clonus, especially in the lower extremities. So now in terms of special tests for the shoulders, I would perform the apprehension test. So if you can just lie back, please.
Lie back.
Yep. This checks for shoulder instability. So if you can bring your arm out to the side and bend it for 90 degrees like your goalpost. Perfect. And now I'm going to gently rotate your shoulder backwards. And with this test, I'm watching your face and your body for any signs of apprehension. I'm also checking to feel if the shoulder feels unstable or if your shoulder might pop out or shift. And apprehension test negative. So now we can move on to rotator cuff strength. So these muscles are the supraspinatus, infraspinatus, and subscapularis. So you can sit up now, please. We'll start with the empty can test. So this is testing your supraspinatus muscle. So if you could just please hold your arms out in front of you at about a 45-degree angle like a V. And now rotate your thumbs downward like you're emptying a can. And I'm going to gently press or give resistance. And for this test, I'm checking for pain or weakness. And then the next test that we can do is the infraspinatus, is for the infraspinatus muscle. And please keep your elbows bent at a 90-degree angle, tucked at your sides like you're holding a towel. And now you're going to rotate your forearms outward while I gently apply inward pressure. If you have any pain or weakness with the resisting movement, that may indicate an infraspinatus injury or inflammation. So now we can move to the subscapularis. So this is internal rotation resistance. So we can do this 2 ways. The first one will be placing your hands on your back, on your lower back, and then trying to lift your hands away from your back while I put resistance. And then if you could not perform this test, you can place your hands flat on your abdomen and push inward with your elbows out to the side. And now I will apply slight resistance. Looking to see, for this I'm looking to see if you cannot lift your arms away from your back or there's pain while pressing on your abdomen. Was there anything?
There was not.
Perfect. Now we can move on to special tests for the wrist. So we will do the Finkelstein test. So for this, I'm going to have you make a fist with your thumbs on the inside of your hands like this. And then I'll have you bend your wrist downward toward the pinky side. And with this test, I'm watching for any pain along the thumb side of your wrists. If you feel sharp pain or discomfort, that is considered a positive Finkelstein test. And then next we can do Tenniel sign. So I'm going to have you put your hands out like this. And this is assessing for carpal tunnel syndrome. I'm going to gently tap on the area inside of your wrist right here at the base of your palm. if you can just let me know if there's any tingling, numbness, or like an electric shock feeling.
There's not, no.
Perfect. A positive Tenniel sign would be indicative of irritation or compression of the median nerve. And then next we can perform Fallon's maneuver, which is when you place the backs of your palms together, like an upside down prayer. This also checks for carpal tunnel syndrome. And they should be chest level, pointing downwards. During a normal exam, we would hold this position for 60 seconds to see if there was any pain, but for now, is there anything?
There's not, no.
Perfect. For the spine, we can perform the straight leg raise. So I'm going to have you lie flat on your back again. And I'm going to gently lift one leg at a time, 70 to 90 degrees, while keeping your knees straight. I'll have this hand on your heel and dorsiflexing the foot, pulling the toes towards the shin. I'll see if this reproduces any symptoms. Just let me know right away if there's any tenderness or numbness or tingling, especially in your lower back. And I would do the same thing for the other leg. Any numbness, pain, or tingling?
Nope.
Perfect. Now for the knee, I can do the anterior and posterior draw test as well as the Lachman's test for ACL, PCL stability, or McMurray's test for meniscus tears. So you're already lying down, and for the anterior and posterior draw tests, this helps me assess for the stability of the major knee ligaments called the ACL and the PCL. And so I'm going to have you bend your knee about 90 degrees, and I'm going to stabilize your leg with mine, and I'm gently going to pull the tibia forward. This is anterior draw, and backwards, which is for the posterior draw. If the shin moves too forward or too backwards or feels loose compared to the other leg, that may mean an ACL or PCL tear. And then I can do the other leg as well. And again, I'm looking to see if the knee feels like a draw moving in or out, which could indicate an ACL tear or injury. We can also perform the Lachman's test, which is similar to the one we just did. Instead, your leg is 20 to 30 degrees, and I'm going to hold the thigh still with one arm and gently pull your shin forward with the other one. And if the shin moves too far forward or stops or feels soft or mushy, this may be a sign of an ACL tear or injury. So next we can do McMurray's test. So this helps check for any possible meniscus tears. So I am going to bend your knee and your hip so it is at a 90-degree angle. I'll hold your heel in one hand and place the other hand on your knee. And I'll rotate your leg outward and slowly move it down. And then bend your knee again, turn it inward, and slowly move it down. Here I'm feeling for any clicking, popping, grinding, or tenderness, which all special tests are negative on exam. And so now we can move on to the neurological part of the assessment, so you can sit up. So we'll start with mental status. I'm going to ask you a few questions to check your orientation. So what is your name?
Jacob.
And what is today's date?
I believe it's the 24th.
Okay. And where are you right now?
In Providence
And why are you here?
for a full body exam.
Perfect. Patient is alert and oriented times 4. So now I will test your attention and concentration. So what is 5 plus 5?
10.
What is 5 plus 7?
13.
What is 4 plus 4?
8.
Attention and concentration are intact. So now I will test your memory. So I'm going to say 3 words: house, globe, candle. If you can just say them.
House, globe, candle.
And then if you can just remember them, I'm going to ask you to recall them in a few minutes. So now I'm going to test your short-term memory. What did you eat for breakfast this morning?
I had eggs.
Perfect. And to test your long-term memory, what was the name of your high school?
Pontiganza.
Perfect. And now to test your immediate recall memory, can you remember what those three words were?
House, globe, candle.
Perfect. Short-term, long-term, and immediate recall memory are intact. So now I can test your language. I can ask you, what is this object?
That's a battery.
Perfect. And now repeat this phrase, no ifs, ands, or buts.
No ifs, ands, or buts.
Perfect. Now I'm going to ask you to perform a 3-step command. You can take this paper, fold it in half, and put it next to it.
Yes.
Perfect. Ability to follow commands and language intact. So now I will test just with a couple more questions. What would you do if you found a stamped addressed letter on the sidewalk?
I would probably bring it to the post office where it belongs.
Perfect. And now, what does this mean? What do apples and oranges have in common? Okay, what do pools and lakes have in common?
Both have water.
Perfect.
Oh, they're both a fruit.
Abstract thinking and judgment intact. So now we will test cranial nerves. So for the cranial nerve 1, I will ask you what you smell.
Mint.
Perfect. And then for cranial nerve 2, which is the optic nerve, we performed your visual acuity test with the Snellen chart during the HEENT part of this exam, and we also did the fundoscopic exam earlier. So for now, I will test your confrontation fields. So please tell me when you see my fingers wiggling in.
I see them. I see them. I see them.
Perfect. And then for cranial nerve 3, 4, and 6, which are, can you please follow my finger with your eyes, moving your head, not moving your head, which we also did earlier as well. Perfect. And to test cranial nerve 5, or the trigeminal nerve, I'm going to ask you to close your eyes and just tell me when you feel this.
Yes. Yes.
And where do you feel it?
Both cheeks. Chin, both sides.
Perfect. And this is testing facial sensation to light touch, but we can also test with pain, temperature, sensation, and vibration. You can open your eyes now. And if you could just please bite down, this is testing your mastication muscles. And then to test cranial nerve 7, or the facial nerve, I'm going to ask you to raise your eyebrows and close your eyes really tight and puff out your cheeks like a fish and smile with your teeth. Perfect. Here I'm assessing for symmetry and strength, and then I'm also going to place this on the anterior part of your tongue. Please tell me what it tastes like.
Mint.
Perfect. And then for cranial nerve 8, or the vestibulocochlear nerve, I could either perform the finger rub test in addition to the tests we performed earlier, including the whisper test, as well as the Weber and Rhine tests. So right now I will perform the finger rub test. I'm going to stand next to you. Please cover one ear, so your left ear. Can you hear this?
Yes.
And the other side.
Yes.
Perfect. And then to test cranial nerve 9 and 10, or the glossopharyngeal and vagus nerves, can you please say ah? And this is testing palate elevation, and the uvula should rise in the midline. I'm also going to check your gag reflex. Okay. And I'm also looking at voice quality here. Gag reflex intact. So now to test cranial nerve 11, or the accessory nerve, as we performed earlier, can you please shrug your shoulders against my resistance and turn your head against my resistance. This is also testing muscle strength as well. And then for cranial nerve 12, or the hypoglossal nerve, can you just please stick your tongue out for me? Perfect. And move it side to side. Movement should be intentional and the tongue should be midline. Cranial nerves 1 through 12 are intact. So now we will test motor function, tone, and coordination. So I'm inspecting your muscles for any atrophy, asymmetry, and abnormal or involuntary movements, such as tremors, twitches, or fasciculations. I'm also assessing the muscle tone, looking for any hypo or hypertonia. And muscles are symmetrical with normal tone and no asymmetry or abnormal or involuntary movements noted. And we already performed muscle strength in the musculoskeletal part of the exam. And in terms of coordination, I will ask you to touch your nose with your finger and one outwards like this, and then switch, and switch, and switch, and then put this one down. You can touch my finger back to your nose, and touch my finger back to your nose. And then now we can also test this by placing your palm, the backs of your hands on your knees, and switching 5 times, going back and forth, back and forth, back and forth, back and forth. We can also do the lower extremities by sliding your heel down the shin, or the opposite shin. Perfect. And coordination is intact in the upper and lower extremities. And now we will test sensory function, so you can have a seat. I will lightly touch your skin, checking for pain with the sharp object and temperature with this heated blanket or tuning fork, and then vibration and your sense of position. So if you could please close your eyes and don't open them until I tell you to, and tell me what you feel. So is this sharp or dull?
Dull. Dull. Sharp.
This is testing pain sensation.
Sharp.
Perfect. And now I can test temperature, so I will use a heated blanket and this tuning fork. If you can just tell me if you feel cold or hot.
Cold. Hot. Cold. Hot. Cold. Hot. Cold. Hot.
Perfect. And now I will test vibration sensation with this tuning fork, particularly on your hands and feet and bony prominences. So please tell me when you feel the vibrations.
Feel it. Feel it. Feel it.
Alright, now I will test your proprioception by moving your fingers and toes up and down. Please tell me which one you feel.
Up. Down. Up. Up.
Perfect. Sensation to light touch, pain, temperature, vibration, and proprioception intact in the upper and lower extremities. For the reflexes, we already tested those in the, you can open your eyes, during the musculoskeletal portion of the exam as well. And then for gait and balance, we'll just do this again. If you could just please stand up and walk a short distance. I'm noting any abnormal movements, difficulty, or instability. And next I will have you walk heel to toe, noting the similar things as before. This is called tandem walking. Perfect. Okay, and next I'll have you standing with your feet shoulder width apart, arms by your side with your eyes closed. This is called the Romberg test, and it checks for balance and cerebellar function. And no swaying noted. Perfect. You can open your eyes and sit down. Gait and balance are within normal limits. Romberg test negative on exam. So now we can move on to the integumentary system, which I have been inspecting your skin during this whole entire exam, but just again, I'm looking at your skin for skin color, temperature, making sure that there's no rashes, lesions, jaundice, pallor, or cyanosis noted. So skin color is appropriate for ethnicity with no discoloration, rashes, lesions, jaundice, pallor, or cyanosis noted. And next I can palpate, so I am palpating the skin. It should be warm and dry and with an elastic feeling. And I can also check for skin turgor. I can check on your chest or your arm. This checks hydration status. And your skin is smooth, warm, dry, and non-tenting. I can also look at your nails of your fingers and your toes, looking for any clubbing, color changes, or deformities, which none are noted. And I can also check your scalp and your hair. I would check your scalp for any lesions, lumps, bumps, and make sure that the hair is appropriate, which hair is appropriate and no abnormalities noted. And for the thyroid, which is included in the endocrine system, I palpated your thyroid during the HEENT part of this exam. But again, I would note for any nodules or masses. I'm also looking at the skin color of your neck, looking for any dark patches, which could suggest diabetes. And then in terms of puberty for pediatric patients, I would look at or assess their progression through puberty based on the Tanner staging. And then in terms of the lymphatic system, I assess the majority of your lymph nodes also in the HEENT part of the exam. And those were in your face, your neck, your underarms. The areas should be soft and non-tender. So I already performed these ones, but we can also do ones down here, which are the inguinal lymph nodes. We can also do the supraclavicular and infraclavicular lymph nodes. We can also do the mediastinal lymph nodes and axillary lymph nodes, aortic lymph nodes, pelvic lymph nodes, and inguinal lymph nodes. Mediastinal, axillary, pelvic, and inguinal lymph nodes are within normal limits without enlargement or tenderness. And then in terms of the spleen and the liver, I've already checked for enlargement, which can indicate infections or blood disorders, things like that. So that will conclude our full head-to-toe exam. Do you have any questions for me?
I don't.
Perfect. I'm going to sanitize my hands again. Would you like some hand sanitizer?
Good, thank you.
Perfect. Let me know if you have any concerns.
Will do. Thank you.
Thank you for your time.